Serious, doctors of Reddit. What do you think of your country's healthcare? What would you change if you could? Sweden, hematology fellow. I think it's great. There is exactly one insurance that you have to work with and you basically never have to think about whether a patient can afford diagnostics and treatment. So you treat everyone the same, which makes things easier. Lawsuits are starting to appear, but are still rarities. As long as you do not intentionally hurt someone, the worst that can realistically happen is a warning. Repeat offenders that are immune to teaching can lose their license though. As a doctor working at a state hospital, you do not have to worry about insurance and you are not personally liable. Our computer systems are a pain though. Think up to 5 different systems simultaneously. Patient journal and medication, lab data and radiology, clinical physiology, cancer registry, anticoagulation. And I hear the surgeons have it worse. Lots of administrative work which I would love to turf to a medical secretary, but we don't have enough of those. Very few beds, least of all ICU beds. But you go home at 4:30 p.m. I'd get a decent IT system running, hire more staff to help with administration and open up more beds. For that, hire more nurses. I hate that about administration. In the UK they keep cutting costs by getting rid of the administrative staff, which is extremely stupid. Instead of paying someone considerably less than a doctor's wage, who is good at the paperwork, you just end up paying a doctor to do it who isn't as fast and costs more. British GP trainee. I've worked in 8 different hospital medical surgical specialties ranging from urology to geriatrics and 2 GP surgeries, one in the most socio-economically deprived part of my city and one in the wealthiest, Anna in Bevan, the chap instrumental in founding the NHS, said, illness is neither an indulgence for which people have to pay, not an offense for which they must be penalized, but a misfortune, the cost of which should be shared by the community. I am proud to serve these noble principles. In addition, a study in 2011 found the NHS saves more lives per pound spent than any other country apart from Ireland. Among the 17 countries looked at, the US was the least efficient. When I think of my sick patients, the 30-year-old who cannot walk due to cord compression secondary to metastatic malignant melanoma, the 98-year with reduced mobility and weight loss, the middle-aged woman with new rheumatoid arthritis, the NHS has protected them at their most vulnerable. They get excellent levels of acute care, don't bear the brunt of the exorbitantly priced chemomonoclonal antibodies and, in Scotland at least, have carers come into their homes up to 4 times a day to help them with their activities of daily living. For free, the same standard of care regardless of what you earn. Having said that, I often question how long I can stay working in the NHS. The geriatricians I work with started their careers looking after patients who grew up pre-NHS. Comparing them to the patients who were born into the NHS, their expectations, nay, sense of entitlement, is profound. My perspective is that perhaps if people get something for free, they don't value it. The level of inappropriate demand, which is felt mainly by the gatekeeper GPs, is depressing. Drug addicts who will ask for their sick note in one breath and then tell you how they went illegally fishing in the next. The woman who asks for a house visit because she had a paper cut. The young adult who thinks that the local Tesco ought to have more gluten-free sandwiches and thinks it is your job, doctor, to do something about it. The relatives who see granny once a year and are shocked to find her frail, struggling on by in a dirty flat and demand that something must be done so long as it isn't done by them. It seems to me that there are more and more, dang it, I'll call them what they are, time wasters you have to battle through in order to treat your ill patients. Couple this with a government who understandably, given that our aging population will cause our costs to skyrocket, want to run the service on a shoestring budget, a health secretary who seems to take pleasure in kicking the medical profession, endemic levels of understaffing. I wonder whether the NHS is sustainable at all. I hope it is, but I'm not sure what it will look like in 25 years or if I would be able to cope with being part of it. Our NHS is something I'm immensely proud of over anything else in the UK. If we could replace people's sense of entitlement with pride, then we might be halfway to solving some of the issues. I'm in Brazil. I'm an MD PhD, working with epidemiology and cost-effectiveness analyses. I work for both a public hospital and for a private insurance company, so I feel quite confident in talking about our healthcare system. We have 2-tiered coverage. 75% of the population relies solely on the public health system, and 25% have private coverage. Private plans are regulated by a national agency. There's a standard coverage list, limits on copays, limits on annual price raises, and many other requirements. Service is usually good, barring focal difficulties for old and regulated plans and the like. The public system is vastly criticized, sometimes with reason, sometimes not. I feel it's important to say it's viewed more favorably by those who actually use it than by those who don't. Overall, I'd say it's a good system with some very serious choke points. If you need a basic consultation or cancer treatment, you're absolutely going to get it in a timely manner. If however you need elective surgery or maybe an ultrasound, it's gonna take forever depending on your location. If you need urgent care, it better be really urgent, otherwise it's gonna be a long wait. Some cities are achieving 100% primary care coverage, meaning everyone in the city has a reference primary care team, physician, nurse technician, health agents, such as Florianopolis. Many lag behind, both for lack of funding and for lack of proper management. There's such great variability in the system, with places of internationally recognized excellence and places that should not have a license to function. We have one of the best vaccination programs in the world, with over 95% coverage for all 26 vaccines. It's over 100% for the main ones. We have a very large transplant program, and although demand is still higher than donors, our rate of donors per million population has doubled since 2008. 7.2 in 2008, and now 14.2 in 2014. We also have the broadest HIV/AIDS program of developing nations and, one could argue, a quite successful one. I'd say we have definitely influenced global AIDS and health policy. All this is free at the point of care. Overall, we're simply a nation aiming to provide universal care at the level the UK does, but with $800 per capita instead of $3,000. I'm proud of many aspects of our system. There certainly is a lot to fix and improve, and I believe we can get there, with time and effort. Let's see. Australia. I'm a health policy analyst, so I've spoken to many clinicians but I'm not one. The Australian system is excellent and we get good outcomes at a very efficient price by world standards. The system basically works as follows. The federal government has a universal insurance scheme called Medicare, paid for by income tax, which pays a fixed amount for doctors' visits, imaging, and pathology. Most doctors will see a patient for the amount paid by Medicare, called bulk billing, means the doctor visit is free to the patient. The rest require a co-payment from the patient. You choose your own doctor. State governments fund the public hospital system, which is available to all and is free of charge. The Pharmaceutical Benefit Scheme, another federal program, covers the cost of prescription drugs minus a small copay. There is a system of private health insurance that is subsidized by the federal government that covers elective surgery and stays in private hospitals as well as some extras like glasses and dental. Strong points are the universality of the system. Everyone is in the same boat when it comes to primary care and free access to GPs is not difficult to find, and hospitals provide good quality care without any cost to the patient. Quality of doctors and allied health professionals is very good. Weak points are the private health insurance, which in my view delivers poor value to most people, does little to relieve pressure on the public system and is the recipient of billions of dollars in subsidies that would be better spent on services in public hospitals. Lack of coverage for dental care. Out-of-pocket costs are increasing, especially for some medical devices and allied health, dentist, physio, etc. Long waiting times for elective surgeries in the public system. Finally, someone that gets it. I work in the industry. It's mind-blowing seeing people reactions when I tell them I prefer public hospitals over private. Public just provide better care, and I don't give a rat's if I have to share a room with someone. American physician. I think healthcare here has so much potential but is stuck in the hands of special interests who own and control the government. The system serves those who profit from it very well. Insurance CEOs, hospital administrators, patients and practitioners are at the mercy of these special interest groups who couldn't care less about public health or patient well-being. I think it's terrible in general. One perk about the American system is we have some incredible institutions here that are on the cutting edge of science and innovation and offer the latest and greatest research and treatments. It's awesome if you have the means and money to access them. Healthcare consultant currently living in Germany here. It's average. It has its good point. Low waiting times for hospital-based procedures. Fairly good coverage with basic insurance, but also its lows. Long waiting times for specialist treatments. Bad quality of nursing associated healthcare professions. Huge gap between private and public patients. What I would change. Abolish the current system of private insurance for the bigger incomes and public servants, self-employed, etc., and bring them back into the public system. It does not make any sense to remove the best payers from a system that is based on solidarity. If you want more, you can still insure you additionally for luxuries like privileged treatment, private rooms, etc. Do allow agglomeration of doctors much more freely than it is now. Make it the norm, not a rarity. The current system of single doctor clinics is highly ineffective and toxic to the political environment in many ways. Restore the old Eastern polyclinic as the norm. Increase the qualification, bachelor's degree FH, for the associated health professions, nursing, paramedicine, physio and ergotherapy, and let them practice their profession not based on doctor's referral. Make them a standalone part of the system. Increase the treatment range, and therefore qualification and budget of GPs. Currently a lot of GPs only serve as prescription pushers, referral writers and sick note viewers. May it be due to qualification or budgetary concerns. Abolish the current system of payment for ambulatory treatment. Make it effort-based, not quota-based. Allow doctors to charge a different amount for specials but force them to offer basic appointments for the majority of the time. You want an appointment after 6 p.m. No problem. This is €25 out of your pocket. For frick's sake, start to tridge. Most German hospitals do not tridge emergency patients. Nearly 100% of the medical doctor's surgeries do not tridge a patient. Punish patients. You lied to your tridge nurse. Told her you have heart problems because you knew you would get in directly instead of waiting for 3 hours. Bam. Huge fine for you. Waiting on a Canadian. Sure, it's free, but it can be a lot better. American physician here. I work in a busier in NYC. I have a lot of patients that don't have insurance. When they ask me, how much does test X cost? How much does pill Y cost? I cannot give them a number. Hospitals do not give providers access to the actual costs of things. It's infuriating to have to always say, I'm sorry, I don't know, and I can't find that out for you. American health insurance is terrible. Patients expect you to know what their insurance covers. When they call, it isn't a guarantee of benefits, of course. But it isn't if I say I think it is covered either. And is that really what you want your doctor to spend his time thinking about? How all the different plans pay for procedures and medicines? Insurance companies have pulled an amazing scam. They create a complicated system by which they pay for your healthcare, and they somehow shifted the burden of this onto the physician. When someone has a question about their complicated insurance, they ask the doctor or his staff. If they have a complaint, they complain to the doctor or his staff. The doctor gets paid less and has to jump through hoops. The patient gets less health care compared to every other Western country, but pays both more out of pocket and in taxes towards healthcare than any other Western country. And yet, patients love insurance. They shop for doctors based on their insurance. 90% of every question a patient asks me is about their insurance. Patients love insurance. No, we don't. Medical bills in this country are so out of hand we can't afford to do anything without knowing if it's covered. We ask not because we love insurance, but because it's the only way to avoid financial ruin. Canadian addictions counselor. Have personal friends that are doctors and I work in the same system. I can speak for Alberta but not elsewhere. Canada healthcare is free, you pay it in your taxes, and need to maintain your own accountability with the province to ensure you have coverage. If you do not, it gets costly very fast. Not American expensive, but when you expect a free ambulance ride and it costs $500, it is a shock. Wait times are long for everything. Even something as simple as getting a medical done can take 2-3 weeks if you are in a smaller, crappier center. Canadian physicians are also contracted service, which makes releases from my side of business sometimes difficult to obtain. Canadian physicians also need to deal with all the differing insurance companies. Many here in AB use Blue Cross, but there is Merit and more. Sometimes really confusing for patients and physicians. In terms of my job, we work to keep wait times low, but for treatment centers, sometimes there is a 4-10 week wait. It sucks. Surgeries are worse. You need a new knee, 6-9 months on average. Shoulder surgery, 4-7 months normally. Dental is not included in Provencal covered medical. You need separate benefits for that. Dental is not crazy expensive, but the Dental Association raised rates about 15 years ago, and the Blue Cross coverage I have never changed the pay rates, but increased fees. I pay $5 more a month for worse coverage than I did 15 years ago. Canada has it pretty good at times, but the wait times, mismanaged funds from the top dogs, top heavy systems, disconnected managers from what really goes on is a continuous problem. Man, that $500 ambulance ride would be $5,000 in the US. I was in a car wreck and the ambulance came. I wasn't even hurt and refused treatment. I still got a $2,000 bill for them showing up. General surgeon here. An MBA friend of mine put the whole problem of the healthcare system in the USA into one sentence: we have tried the healthcare system in the US based on a capitalistic model for 100 years and it doesn't work. It's time to try something else. A single payer system seems to be the model other countries have the most success with. It's not perfect, but everyone is insured and are not devastated financially by an accident or illness. There is great resistance to change the system we have, even if it sucks, because people resist change and there are a lot of people making a lot of money with the present system. That is all. You have been visited by the science dog. Go upvote now and you will get high grades and good results within the next week. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check out another video, or don't. Either way, have a great day, you magnificent people.